Hi, I'm Dr. Gerard Roberts. I'm a pediatrician in private practice at Genuine Health. I'm here today to discuss things you should know to keep your baby safe during sleep. Did you know that in most cases of sleep-related infant deaths, parents did not use any substances? But if parents do use alcohol, drugs, or take a prescription that causes drowsiness and choose to co-sleep with the baby, the risk of sudden infant death increases. While most sleep-related infant deaths occur when parents are not under the influence of substances, the risk of sudden infant death significantly increases if the parents choose to co-sleep with their baby while using alcohol, drugs, or medications that cause drowsiness, even if they are prescription drugs. It is also important to remember co-sleeping with a baby when a parent has consumed alcohol or drugs elevates the risk of sudden infant death syndrome, or called SIDS, S-I-D-S. Substances can impair a parent's ability to respond to a baby's needs during sleep, increasing the risk of accidental suffocation. To minimize the risk of SIDS, healthcare professionals strongly advise against co-sleeping with a baby if the parent has used any substances that can affect their alertness. Did you know that sleep-related infant deaths disproportionately affect African Americans, Native Americans, and Alaskan Native infants? African American infants are often reported to be more than twice as likely to die from SIDS, or sudden infant death syndrome, compared to white infants, while Native Americans and Alaskan infants also have rates nearly 3 times higher. Possible contributing factors include differences in access to health care, cultural practice around sleep, socioeconomic factors, and potential disparities in awareness about safe sleep practices. Did you know that the infant mortality rate due to accidental suffocation and strangulation in the bed was about 48 per 100,000 live births? They were either surrounded or covered by pillows and blankets or propped up on bobbies. 82% of the unintentional infant suffocation deaths in the United States are attributed to accidental suffocation strangulation in the bed. If a blanket, pillow, bobby, or stuffed animal's soft bedding or crib bumpers get on your baby's face, they can suffocate because they are not physically capable of moving it away. Every year in the United States, approximately 3,400 infants die from sudden unexpected infant death. This is preventable death. Items such as blankets, toys, and stuffed animals can put your baby at risk for accidental suffocation or strangulation. Did you know that the size of your baby's airway, which takes oxygen into the lungs, is smaller than most straws? A baby airway is the size of a cocktail straw, meaning even small obstructions can easily block their breathing, making them more vulnerable to breathing difficulties, particularly during sleep, especially when they are under 4 months old, which increases their risk of sleep-related death. Infants under 4 months old have underdeveloped muscles control in their airway, making them more susceptible to breathing disruptions during sleep. This small airway size is a contributing factor to sudden infant death syndrome, or SIDS, which is why safe sleep practices are crucial for young babies. Put your baby on their back for naps at all night. Use a firm, flat surface. Never sleep with your baby. Instead of bed sharing, room sharing with your baby. Keep soft objects and loose bedding out of your baby's sleep area. Do not let your baby get overheated. Consult your pediatrician if you have any concerns about your baby's breathing.